you often experience pain or locking of the knee just like this? Are you between the ages of 10 and 20? Well, there's a possibility that it's not just growing up aches and pains. Don't take it lightly because it could be OCD of the knee. But don't worry, I'm here to help you.
Hi everyone, welcome to my channel. My name is Arav Huda and I'm a grade 10 student. Today I'm starting a series on osteochondritis dissecans or OCD. This topic is very personal to me because I have undergone surgery for OCD and I would like to help others go through this process by easing their fear and shock. In this series, I'll be covering an introduction to OCD, symptoms, causes, diagnosis, treatment, and the recovery process. Helping me provide extra credibility to my information will be my doctor, James Hui, and my physiotherapist, Amanda Tham. Dr. James Hui is an orthopedic surgeon at the National University Hospital in Singapore, and he's pretty much an expert when it comes to osteochondritis dissecans. Dr. Hui is also a key member of the ROC group, which is dedicated to researching and finding better ways to treat OCD. Amanda is a musculoskeletal physiotherapist with over 8 years of experience. She specializes in spine issues and sports injuries. Now, let's move on to what is OCD. Osteochondritis dissecans is a joint condition where a segment of the bone and cartilage separates from the end of the bone due to a lack of blood flow. It's more common than you might think and primarily affects adolescents and young adults who are active in sports. Common symptoms of OCD include pain in the affected joint, locking, and stiffness. The symptoms can vary depending on the affected joint and the severity of the condition. Personally, I felt pain in my knees and experienced locking, especially in my right knee. The exact cause of OCD is unknown, but it could be related to overuse, genetics, and repetitive trauma. Factors like age, gender, activity level, and genetics can affect the risk of contracting OCD. To reduce the risk of contraction, it's important to avoid repetitive stress on the joints and maintain a healthy lifestyle. Now, let's hear it from the expert. Can you explain what osteochondritis dissecans is in simple terms?
Okay. Well, osteochondritis dissecans is a condition where the small part of the bone and cartilage it gets separated from the bone and became a loose body.
How common is OCD and who is most at risk?
Osteochondritis dissecans is relatively rare in the general population. However, in the age group of teenagers and also in the sports crazy group of people, then it become more common. Hence, if patients come to my clinic, we feel, wow, there's so many OCDs around.
What are the most common symptoms of OCD that patients should look out for?
Okay, typically, if you start maybe pain whenever you exercise, also you get some catching feeling, my knee joint catches, or sometimes even it lock, and occasionally you feel stiff. So all these can be the symptoms make you suspicious of OCD.
How can the symptoms of OCD vary depending on the joint affected and the severity of the condition?
So, of course, the very mild ones may be just a bit of niggling pain and maybe like after exercise. Then to very severe ones in the knee, finally it start to catch you whenever you start to move. But of course, remember it can also affect other joints such as elbow joint, especially in competitive gymnasts, people who does use a lot of upper limb, and also in ankle. I think also getting a bit more frequent because I think people are participating in more lower limb related activities such as football and all that.
How is OCD typically diagnosed?
It'll be a combination of patient's history. When patient tell you they have pain and all that, then physical examination. Typically, I will examine and then I feel maybe a catch, or patient cannot straighten the knee fully. And of course, then we do x-rays, and the gold standard probably is MRI.
What are the underlying causes of OCD?
Yeah, OCD till today is still really unknown. But research did show that this area where we think this is the end of the blood supply to the cartilage, and if this part is like a river, if upstream got blocked, then you have no blood flow downstream, then you die here. However, in the current very sports craze world, a lot of the repetitive sports activities are the one contribute to, especially like in gymnastics. If you keep on pounding the same area, then they believe that this will cause OCD.
Are there any specific activities or behaviors that increase the risk of developing OCD?
As I mentioned, either very high impact or very repetitive in the same area they will cause. And like in ankle, like even patients who had repetitive ankle sprain, and in elbow, especially in American context, like the baseball players and the gymnasts.
How do factors such as age, gender, activity level, and genetics influence the likelihood of developing OCD?
Males seem to have more, but I don't know whether just because boys are more active, hard to judge. But teenage years certainly contribute to that, and as I mentioned earlier, the levels of physical activities.
Are there any preventive measures individuals can take to reduce their risk of developing OCD?
Well, I guess if you're a couch potato, you'll never develop OCD, but you don't want to be that, right? You want to be active physically, maintain a good health. However, when you're doing it, try to do it as evenly over, the whole body, and not just doing one area. Hence, in American context, they tell parents, try not to train your children to be a super specialist too early, meaning like 8 or 9 years old, you keep on pumping and forcing the same area. You're trying to repeat and do the same motion, and that will decrease the risk of getting.
That's all for today. Thank you for listening. Stay tuned for the next video where we'll dive deeper into the diagnosis and treatment of OCD. Don't forget to like, comment, and subscribe.